In this video, we will cover what depression feels like and how it can affect you. Firstly, there's a big difference between everyday sadness and depression. It's normal to feel sad, and it happens to everyone. Depression, however, is a medical disorder that requires treatment. Sadness is an emotion that passes, and depression is a mental illness. While many depressed people experience similar symptoms, depression doesn't have one face. It affects different people in different ways. So, what does depression feel like? Depression can feel like an extreme sadness, not necessarily connected to life events. You may feel like no one and nothing could make you feel better. You may also feel hopeless and like there's no joy or pleasure in life. A common thought among those experiencing depression is, what's the point? What am I doing and why am I here? Depression can also feel like numbness, as if you just can't feel anything. Things that used to make you feel happy, excited, or hopeful just don't do it for you anymore. When you're depressed, you may be more likely to experience headaches, muscle aches, and other pain or discomfort throughout your body. Fatigue is another common symptom of depression, and it may be low grade or extreme. Lastly, if you have depression, you may feel a heaviness or pressure throughout your body, like there's a weighted blanket on you. You might be thinking, what can depression look like? How does it change your everyday life? The extreme sadness, lack of interest in life, and feeling of heaviness can make it impossible to do anything. You might not be able to get out of bed, brush your teeth, shower, eat, or go to school or work. You might also experience an increase or decrease in appetite. Some people seek out comfort foods. They overeat and eat emotionally to cope with their symptoms, while others lose interest in food altogether. Sleep disturbances are another common side effect of depression. You may find yourself sleeping more, less, or having trouble staying asleep altogether. Depression can affect you in a lot of different ways. You may have a couple of these symptoms, or most of them. It varies from person to person. Whatever your symptoms look like, depression is a real medical condition. You can't just decide not to be depressed. It's much more complex than that. Your psychiatrist can identify whether you have depression and prescribe any necessary medication. In many cases, a therapist will be essential to your treatment plan as well. If you're experiencing any of the symptoms you learned today, we encourage you to seek medical attention. A clinician can confirm your condition and recommend a treatment plan.